go ahead and find somewhere suitable to stand and move. Ideally, I would do this every morning first. We come in and we do some qigong together.
We should.
So I will sprinkle a touch of that in. We can't go through the full cycle 8 brocades, but I want to reflect on a big thing that I believe in is movement systems that have stood the test of time have done so for a reason, right? So systems like yoga, qigong, and tai chi have stood the test of time for a very good reason, and it being that if you look at how these systems are coordinated, they have a person move each region of their body through multiple planes of movement. It's basically that simple. And then they usually have you think about your breathing at the same time. All right? So let's start actually initially with breathing. That's one that we didn't talk about. But you put your hand on your chest, right on your sternum, hand on your belly button, and then just take a nice deep breath and see what moves the most. Ideally, you let your belly move. A trick here is to let the belly out. I remember hearing, it was on the radio, of them talking about doctors saying it's important that people stop sucking their gut in because it's restricting breathing. And you know what that does? It messes with digestion, all kinds of stuff. So sometimes with good breathing, you gotta let the belly out even if it's not exactly what you want it to be, right? I gotta work on it before the wedding. It's okay. But here, let the belly out. Now I can exaggerate this, so I can really make and come back in. Right now, that's just, is that a showing off? I don't know. But to breathe, now there's certain things you can play with here too. Try like making your feet real tight, like clenching your toes to the ground, and seeing if that makes it easier or harder for you to take a breath through your belly. Contracting your feet, does it feel easier or harder?
Harder.
Harder. Much harder. Isn't that a cool thing? Now, relax your feet. Try to take a breath with your belly again. Now clench your feet. Right, make them angry. Now try it again. The lesson being, can we see how muscle tension of the areas of the body could translate as far as into respiration? Right? How I could make an argument from a treatment standpoint that affecting a person's feet could affect their breathing. Aside from the reflexology construct, which may have a component to it, don't get me wrong. Like there may be a component there, even related to just what we talked about with sensory motor responses, but cool stuff. More tension anywhere, at the very least, can have an effect there. Ideal breathing pattern should be predominantly through the belly and not seeing, like this would be an exaggerated wrong response of, right, or like that. Predominantly, ideally, through the nose. Now, if something's off, like a deviated septum or something here, then naturally that's going to make sense to be disrupted. But ideally, when they talk about appropriate breathing, through the nose and out through the nose is ideal, okay? At the very least, in through the nose, out through the mouth. But instead, there can be some factors that get in the way of that. And then the count ratios should usually be at least a 1 to 2, twice the exhale to the inhale. Let's try that. So let's do like a 2-second inhale to a 4-second exhale. Now, at first, breathing out through the mouth can be easier because you can purse the lips and treat it like you're exhaling through a straw, all right? There are ways to kind of contract what it'll feel like the nose to kind of, but it'll feel like you have to kind of hold and restrict the exhale through the nose. One factor I really lean into with helping a person identify what feels like good breathing is an identification of what a full exhale is. So you have the relaxed inhale and exhale where it feels like you're not really putting any effort into it, or there's like you're playing a wind instrument, or I guess any instrument, where you're having to force that exhale to kind of full tilt, or you could even increase the inhale to full tilt. But the exhale is one that usually people can identify a little bit more with, like, and you keep going. So try this with me. And you should feel like you have to contract. You should feel that what we're doing when we're doing this, so we'll do it for real here in a little bit, like you're really trying to force your belly button in, right? So you're trying to like contract the abdominal muscles and create pressure here to the point that not only is all the air out of the lungs, but you should feel like this has pushed and contracted as much as possible. For a better stance here, just protecting everybody's low back, let's do a little bit of our Tai Chi stance. Feet at least shoulder width apart, a little bit wider if that's more comfortable for you. Unlock the knees just a touch. Let your pelvis curl under you. So if you look at my low back, I'm trying to kind of just curl my low back. That gets these obliques, these lower obliques, a bit more activated. But if I feel anything, I'm trying to activate these lower obliques and my glutes just a little bit. But knees unlocked, and you stand like this and you live like that forever. Weight on your heels. Remember that with your body mechanics. Okay, then with the exhale, so take a normal inhale, doesn't matter what. Then full exhale, really feel that belly button go in. When you push all that air out, feel the reflex as you inhale. I have had much more success with teaching people what it feels like to get that diaphragm to contract by having them feel that full exhale first, because the recoil then feels more natural. So a full exaggerated exhale, then the inhale, then that perception of the abdominal cavity expanding and that diaphragm contracting just feels bigger. And it's like, okay, it doesn't have to be like that all the time, but it can be a place to start when somebody needs help in how to better breathe. Figure out how to do an appropriate exhale, then the inhale will begin to feel more natural. And then if you're doing it for yourselves or you're recommending for a person how to interface with this, and this is good stuff for like sleep, right? Or just regular relaxation, doesn't matter what it is, but especially you're laying there trying to go to sleep, thinking about your breathing and playing with this, it's good for everybody, but these are health messaging things that we can help people with. And you would be amazed, if you haven't really been on a journey with bad breathing and what it means to get to good breathing, it might not make as much sense, but it can be very impactful in a variety of ways, helping you kind of down-regulate and relax faster. And there may be a lot of cool stuff even to digestion that can be helpful here. Because if we use our bellies to breathe more, that's kind of assisting peristalsis. It's massaging your guts as you breathe good. So, now when you're exercising, it's not like that. This is the important factor. But when you exercise, you're stressed in a good way, then the breathing does go to more of a one-to-one. And it should be that. If you're going into like high intensity cardio, like that's what it should be. And it will be, and you will activate the upper chest breathing muscles. That is totally natural, totally normal. But then coming out of that, we want to return back to this 1 to 2. And there can be arguments to going to more to a 1 to 4. If you're like sedentary, if you're like meditating, laying down, then you could increase that exhale ratio to a 1 to 4 kind of a ratio. So 1 second, 2 second inhale to an 8 even usually. I don't know if I go to a full 16 or not, or it's like 1 or 2 to an 8 kind of a deal, right? So there's that. We'll return to the breathing stuff when we round back around on like the Qigong Tai Chi stuff.